if we kind of have that rolled over shoulder, we're tight in the front and we're kind of over lengthened in the muscles in the back. So it creates this muscular imbalance, okay? So, you know, a lot of people will sort of, if you're longer and more weaker in the back of your shoulder, they might give you some banded external rotation, sort of rotator cuff exercises. But the truth is if you're just doing that, but you're not addressing the position of your rib cage, you're just creating a lot of tightness into the back of the shoulder joint, okay? So a lot of people end up with sort of like these compensatory issues from doing like what are well-prescribed rehab exercises, but if they're not addressing the position of the rib cage, they're only getting half the picture. Okay, so if we tend to be sort of stuck in our rib cage where we can't breathe well into the front, but maybe we can breathe better into the back, that's going to change the position of the shoulder on our body, okay? It takes that shoulder blade and sort of slides it forward. And what happens there is we have all these muscles that attach our shoulder and our shoulder blade to our rib cage, okay? And so if our rib cage, for example, doesn't move well in the front, all of those muscles that attach the shoulder to the rib cage also aren't going to move well. So that's when you feel kind of that tightness or stiffness in the front of your shoulder. That's when it kind of starts to pull your body down, okay? And it can pull your neck forward, okay? So to address some of those postural differences that we see, putting air and mobility into the front of the rib cage is going to automatically help reposition our head better over our body, which is going to take a lot of the stress from gravity and tension off of our spine. So what I like to cue is when you're getting ready for your push, think of the elbow sort of getting pulled outward away from your body. So you create this good length of your collarbone and you allow the shoulder blade, just like the row, to go across your body in the back, okay? So as I'm opening up, my elbow is coming off to the side and my shoulder blade is wrapping around my back versus this, okay? So you can see a clear difference there in setup, okay? And it's that setup that is gonna create this nice open chest here, nice full of air chest so that you can get those pecs ready to push. Okay, if those pecs are in here and they're all hollow and closed off and tight, how are they going to push? Okay, so that's the whole point, is lengthen the muscle so it can contract. Okay, just like our glute demonstration with the squats. The part when they're kind of loading that press, the shoulders will tend to come forward and then they'll kind of just push and sort of lock their elbows out. And so I want to get people out of that patterning because you can see as my shoulders come forward how that kind of cranes my neck a little bit, okay? So what we want to do is get more support from the core, okay? And to keep our rib cage nice and expanded, because when I do this, I drop that rib cage and I lose that good expansion that I'm looking for, and I drop my rib cage, okay? And when we learned about when we talked about the abdominals, that's gonna put me in a more upper ab dominant pattern, and I'm gonna lose those lower abs, and I'm going to put pressure on my pelvic floor. So you can start to see how movements that you might not find are related to your core and your pelvic floor actually are. So if we change them up top, we can address some issues down below. So you're gonna take your lacrosse ball or tennis ball, find that same spot you're trying to work, and get your body up close onto the wall. So you're just gonna kind of pin yourself on the wall here, okay? And kind of lean into it and put some pressure. And you can kind of roll around and feel whatever spot might be tender. And if you find it, you can breathe into it and try to use your breath to release it. You can move your arm up and down here. Okay, up and down, circles, whatever you want, side to side, bring it down. Just play around with it and find that tightness that you want to release and kind of flow with it and go with it, and do that again before your breath work, okay?